All right, reproductive system. We'll start with the male. So we did a little preview of the tracing of sperm from production to the outside world. We'll repeat that tracing today. All right, male and female reproductive system. So together they'll make the egg and sperm join. So how many chromosomes are in a sperm? 23. And then in the egg there are 23. So when they combine and they join, a complete person should have 46. Sometimes you might have an extra one because they didn't split during division. So you might get 47, just like Down syndrome, trisomal 21. Testes. So they're divided into different lobes, and we have two types of cells we'll talk about, two main types. So the first one are the tubules, the seminiferous tubules where sperm is actually being produced. So you have this stem cell, like the sperm stem cell, and it can divide. It can make a copy of itself, and then it can further divide and produce sperm. So in the male, the testes are held in the scrotum, and the hormone testosterone is produced by the in-between cells. So those are your interstitial cells. So you have a bunch of these tubules where sperm is being produced, and in between the interstitial cells, that's where the hormones will go from the pituitary to activate them to produce testosterone. All right, let's do the tracing, starting with the site of sperm production. So what are the tubules called in the testes? Yep, seminiferous tubules. So that is where sperm is dividing. There's a stem cell. And because the stem cell can make a copy of itself, men can produce sperm throughout their lifetime. Unlike women and eggs are kind of suspended in division. So eggs don't produce anymore, they just mature. So in the seminiferous tubules, the sperm is then stored in the epididymis for maturation. So if you took sperm directly from the testes, from the seminiferous tubules, they would be inactivated. They wouldn't move, they wouldn't do anything. They actually have to store in the epididymis, mature, and then they'll become activated. So the tube that sends mature sperm is the vas deferens. What's the other name for the vas deferens? Yeah, sometimes they'll call it the ductus deferens. So it's the same tube. Has to go through the abdominal cavity of the male, and this hole is the inguinal canal. And for the male anatomy, especially in the abdomen area, that's where there's a weak spot, and sometimes you can get intestines popping out of that hole. So what's that called? You get some intestines. Hernia, yeah, very good. So that would be an intestinal hernia, an inguinal hernia. So that goes through the abdominal cavity, around the bladder, to meet with the seminal vesicles. So that's going to produce about 60% of the ejaculate, and then the prostate gland will produce the other 30%. 5% from the bulbar urethra, and then the other 5% is fluid within the vas deferens itself. So you got sperm, coagulants, sugars, and prostaglandins that is included in the ejaculate. And then out the urethra, past the glands, tip of the penis, head of the penis, and then the foreskin, pubis. So in the male anatomy, the bladder, the urethra, and the vas deferens join within the prostate. So we'll talk about benign prostatic hyperplasia, and now how that affects the urinary system. All right, spermatogenesis. So we're going to start off with the stem cell. So this is the stem cell. So it has 46 chromosomes. So at some point, 46, I had to already copy my DNA to 92 before I can divide into 2. So the stem cell is 46. It copies its DNA. So it saves one, and then the other one continue on to become sperm, right? So divide a couple more times. So that's how men are able to produce sperm throughout their lifetime. In the case of egg production, every time the cell splits, the other half dies off. Meiosis. So you have 2 more divisions. So here's that first division step. And then there's the second division step. So those division steps are called meiosis because we are starting with 46. We kept 46. Now we need to go down to 23. So each of these guys will have 23 chromosomes. So since there's 2 meiosis steps, right? So from one stem cell, we're actually able to net 4 sperm, right? So these are spermatids. They're not actual sperm yet. They still need to mature. So in the case of the female, this is the first division. This would actually die off. And then when this divides, half of that would die off. And then when this divides again, well, this is where all the eggs are frozen in women. So as they mature once a month, they're just held in this suspension. And that's before the child's born. So this happens before birth. All right, now we have 23 chromosomes, sometimes a little more if they don't separate. We have the head covered by the archsome, and it has a bunch of enzymes. E-N-Z-Y. So those enzymes are designed to eat away the protective coating of the egg. So the first sperm that hits the egg, it's not going to be the first one that penetrates it. You need hundreds and hundreds of sperm and their archosome enzymes to dissolve that outer protection. It is that first sperm that sticks its head in, that's the one that fertilizes the egg. Energy. So energy production is in the mid-piece, and this is where they have a lot of mitochondria. So in Med 111, we talked about the cell. So mitochondria is where sugar and oxygen is burned in the body to make ATP energy in order to propel the flagellum. Quick review. So epi, so right above, so epididymis right above the testes, and that is where the sperm will mature. We have the vas deferens, aka ductus deferens sometimes. Seminal vessel, so that's going to produce sugar, and that's going to be energy need for the sperm. And prostaglandins, that's part of your immune response, and this is going to help coagulate the sperm. So that's 60% of the ejaculation. Prostate, 30%. So alkaline means it's basic, and that's required to neutralize the acidic environment of the vagina. So the vagina is normally acidic in order to prevent bacterial infection. So that's going to be damaging the sperm, so they'll need to neutralize the pH. Lastly, vulvar urethra. So that's Cowper's gland. That's going to produce 5% of the ejaculate, and that's mostly clear mucus-like. And then semen is all the fluids combined. So from the seminal vesicle, prostate, Cowper's gland, and the vas deferens, So the scrotum holds the human testes outside of the body because production is better at lower body temperature. Some animals, they have them actually on the inside. For example, elephants. So elephants actually have their testes on the inside. The penis, you got the shaft. It's made of two erectile tissues, and then where the urethra and veins are, that's going to be not as erectile. So you got these sponginosum and cavernosum. Glands, tip of the penis, and then the foreskin. Have you guys heard of sildenafil?
Yes.
What is sildenafil?
Viagra.
So Viagra was first researched as a blood pressure medication. All right? So if you have high blood pressure, one way to reduce blood pressure is to open up more lanes on the freeway, right? So if you dilate the blood vessels, it would reduce blood pressure. So what they found was there was a side effect, and the side effect was an erection. So they said, you know what, forget this, let's research it as erectile dysfunction med. So you can't market a med unless you research it for that specific purpose. So they got two uses out of one drug. So an orgasm is an autonomic response. Male hormones. So just think parallel to the female reproductive system. So these hormones are coming from the pituitary. Right. You guys know where your pituitary is? Right behind your nose. Right. So if they need to do surgery, they'll actually go through your nasal cavity, and then they'll access your pituitary. So your pituitary has two parts, has a front part and a back part. So the front part is the anterior pituitary, and the back part is the posterior pituitary. So gonadotropin releasing hormone comes from the anterior pituitary, and it goes to your gonads, right? So during puberty, it tells the gonads to ramp up their production. So in this case, what hormones is it going to produce? Male. Testosterone. Right? Follicle stimulating hormone. So the egg, another way of naming the egg is follicle. So in female, it's going to stimulate egg production. So in the males, it's going to stimulate sperm production. So you got this hit of gonadotropin releasing hormone. The gonads start to produce more testosterone, right? So changes in the body, more muscular. The penis lengthens and enlarges, and then production of sperm results. It's all regulated by hormones. Luteinizing hormone, for men, it goes to the interstitial cells. What do the interstitial cells produce? Testosterone. So in the woman, it's going to help support the corpus luteum. So just note that down. Luteinizing hormone will support the corpus luteum. So luteinizing hormone from the pituitary will go to the interstitial cells, producing testosterone. Primary and secondary. So primary sex characteristics, that's making egg and sperm, right? So for males, making sperm. For females, making egg. Secondary is all the physical changes to support either delivery of the egg or sperm. All right, BPH. So this is not cancerous. So non-malignant means it's not cancer. It's just enlargement due to hormonal changes in the male. So it's benign prostatic hypertrophy, enlargement. And what is the best way to detect BPH?
Blood test.
Blood test? Digital exam. So, yep, proctal exam. So, what are they feeling for? Well, they're feeling for symmetry. So if it's asymmetric, then it might be cancer. They want the texture to feel like this, right? So right in between your thumb and forefinger. But if it feels like your nose, then that might be a sign of prostate cancer. Inflammation of the epididymis. So you can have an infection, you can have backflow, and then anything backing up the urethra can enter into the testes and affect them. Impotence or erectile dysfunction, so with increasing age, so low testosterone, stress, and overall physical fitness. Prostate cancer. So at 40, that's when they recommend starting to get your digital examinations. And if it runs in the family, then even more often. Inflammation of the prostate. And then testicular cancer. For Lance Armstrong, it spread to lung and brain. And I think he lost the testicle as well. Men, do you do your self-examinations? Men, do you? No, you're supposed to. Some just do it for the fun of it, but let me know what you want to look out for, right? I'm going to let you know what you want to look out for. So, you need firm pressure. So with your fingertips, you're going to apply firm pressure to the testes, and you're feeling for a lump, right? So that lump should be firm. It should be like a pea size, kind of firm like a raisin, a dry raisin. So once a month, in the warm bath, make sure you do your self-examination. Right? Women, are you guys touching yourself on a monthly basis? It's okay. I think the Pope said it was okay for this reason. So 2 positions, right? One with your hand down, and then the other one with your hand up. And then you're also supposed to look at the contour. So you have to look at yourself in the mirror, because if there is a lump that is firm, we're not talking about fibroids in the breast. We're talking about a firm, hard mass, pea size, raisin size, and it's like curling in, squeezing in, and that might be a sign of cancer. So make sure you guys are checking yourself. All right, we'll get started a little bit on the female reproductive system. So we got the ova. What's the ova? Egg. What's another name for the egg? The the oocyte, the oophore, Graafian follicle, follicle. Do you guys know what's the difference? No, right? They're all eggs. It just names it specifically on the stage of development. So for you guys, you don't have to know. All you gotta know is if they say that's the egg. If they say egg, that's the egg. Oocyte, that's the egg. If they say ova, that's the egg. If they say follicle, egg. Graafian follicle, egg. Right? So we're not going to distinguish them in this class. Just know they're referring to the egg. Estrogen, right? Those are the female hormones. Then progesterones are what type of hormones? Male hormones, right? Do you guys have estrogens? Yeah, you do. You better have some. Women, do you have progesterone? Yeah. Yeah, we both have male and female hormones. The levels are different, which makes the sexes a little different. So that cycle they talk about, from 1 to 28 days, you're cycling from happy estrogen, then it dips, and then progesterone, you're getting a little malish, a little cranky at the end of the cycle. Now it makes sense? Okay, I super simplified it, but that's pretty much the Mr. Dang version. And then the inside, the middle portion. It's not where the egg is maturing, it's where all the blood vessels are. All right, let's quickly do the tracing before we take a little break, and then we'll finish this up after break. So the site of production, well, we should say maturation. So all the eggs that a woman would ever ovulate is actually suspended in that second meiosis even before they're born. It's at puberty is when one egg, usually one egg, will then complete its maturation. So over time, all the damage, radiation, chemicals that a woman exposed her body to, also those potential eggs are being damaged, and you're not making new ones. So ovary, it's going to blister off of the follicle, and it'll just be entering the abdominal cavity. So here we got the finger-like ends of the fallopian tube, the fibra ends, and within the uterine tube, aka uterine salpingo, or the fallopian tubes, there'll be cilia. So that cilia will continuously sweep the contents towards the uterus. We want fertilization to take place in the fallopian tube. However, we want implantation in the uterus. So what's it called when implantation occurs in the fallopian tube? Ectopic. So what's ectoplasm? Outside. Ectopic is outside the uterus, right? So if you have an ectopic pregnancy, it's outside the uterus. So the dome portion of the uterus is called the fundus. And then we'll enter into the body. Generic for the neck, or the opening leading the uterus, is the cervix. Then we have the vaginal canal. And then I think we just did labia minora and labia majora. That's it. So what's this right here? Bladder. All right, what's this right here? The rectum. That's the rectum. What's this right here? That's the vaginal canal. So take a double look when you're identifying those body parts. It's not too bad for the tracing. All right, let's go ahead and take a break. We'll come on back and we'll finish this guy up. All right, let's continue on. What is OO? Egg. So this is the formation of the egg. So as I said before, for us, just recognize egg. What's an ovum?
Egg.
Egg. What's a follicle? Egg. They're all different stages of development. So here I was saying how by puberty, right before puberty, everything already has divided. All the eggs have divided. So you get your primary egg cell, right? Primary oocyte. So remember I said when that division happens, things die off. So the polar bodies actually don't develop into a secondary egg cell, right? So it dies off. And then during ovulation, right, the secondary oocyte will mature into the follicle. Right? So here you kind of see on the egg, as the follicle matures, it develops and then the egg blisters out of it. What is left over? This is the corpus luteum. So this is supported by luteinizing hormone, and that helps produce and maintain estrogen and progesterone if there is fertilization. Infundibulum. So that's the fibrin ends, the finger-like ends of the fallopian tubes. AAA oviduct. What's another name for it? Uterine tube or uterine salpingo. So those fingers will catch the egg within the abdominal cavity of the female body, and the fallopian tube is lined with cilia, sweeping the mucus and the egg towards the uterus. And if the egg is fertilized, then that's going to be the zygote for implantation in the uterus. All right. An embryo will develop. So those cells will just divide. One cell, right, will divide into two, will then cleave into four, and then it starts to arrange itself. Right? So those cells will then start to arrange itself in kind of like a hollow ball, but this is in 3D. Right? So there's an inner layer, outer layer, and middle layer. So that's what they mean when they talk about that developing embryo. The uterus. Endo is the inner layer. Then we have the muscle layer, endometrium, and then we have the surface layer. The vagina has the fundus, that's the dome portion, and then the main portion of the uterus is the body. Rogae are just the folds within the vaginal canal and the uterus. All right, inner layer, endometrium. Then the muscle layer is the myometrium. And you guys recall from the med term, metri means uterus. And then the perimetrium. So here we have the oocyte, the egg that just came off the follicle. All right, it's then caught by the fibrin ends, swept down the fallopian tube. Fertilization usually occurs here, but we want implantation within the uterus. If you have any of this inner layer break off, it can travel up the fallopian tubes and then attach to the abdominal walls, the abdominal cavity. And it's fast-growing tissue, so you're going to treat it just like a cancer if it's outside of the uterus. P&P, you guys heard of a pelvic and pap smear? So men, most likely not, but women, at what age are you recommended to get your P&P? Yeah, so it's supposed to be upon sexual activity because they want to check for polyps. So HPV is the virus that may turn into cervical cancer. So if you do your P&P, it's to detect it early, and you have a better survival chance if it's detected early. Here we see the ovary suspended by its ligament. So right off the outside of the uterus, got a little ligament here, and then the ovary is attached. So the fibrin ends are not attached to the ovaries. They can actually come apart like it's shown here. Mammary glands. So those hormones again, estrogen and progesterone, during puberty will stimulate the growth of the milk ducts and the milk glands. So previously, before they are milk glands, they're actually sweat glands. So with the hormonal influence, the estrogen and progesterone turns the sweat gland into milk producing glands, and then the milk ducts enlarge. The nipple, the areola, that's usually the darker pigmented area. The vagina. So you have the labia majora, those are the outer And then we have the minora. Those are the inner lips of the vagina. Similar to Cowper's gland. So the Cowper's gland produce the mucus-like secretion for the penis. Here the Bartholin gland also produces mucus-like secretion. Clitoris is synonymous with the male penis, so it is erectile tissue. And at the age of about 2 years old, that's when a lot of children discover their genitals. So not until 2 is it effective to potty train them, and they won't discover their genitalia until about 2, until the nerves actually reach and they can feel that tingly feeling you're telling them about when you try to potty train them. So if you try to do it any earlier, it's not going to happen. And this is when children will then start beginning to masturbate as well. Between the anus and the vagina opening, you have the perineum. During childbirth, sometimes this will begin to tear, so they're going to need to cut it. And if they ask you, say yes. Right? Why do you want them to cut instead of it to tear? Yeah, way better. You can control it, and if it tears, it can actually tear to the bone. Good, good. Got a reaction, emotional. Hopefully it triggers a memory. No. During orgasm, so involuntary response, you do get a release of oxytocin. So that's also the tricking chemical. Trick the couple into bonding, because the success of the offspring is better if there's 2 parents. Hypothalamus. So it's going to secrete NGRH, gonadotropin releasing hormone. So where does this go? To the gonads, right? So the hormone tells you where it goes. All right, so here we got the anterior pituitary, the front portion. We got follicle stimulating hormone. So what's the follicle? So what do you think this is going to help produce? Egg, right? And then luteinizing hormone goes to the corpus luteum, right? So remember when the egg blisters off, right, off the follicle, the thing that remains becomes the corpus luteum, supporting pregnancy with hormones. So you get the estrogen and progesterone production from these hormones. So just like the male, first thing we do is make the egg. So the hormone makes it so the body can make the egg. And then your secondary sex characteristics in a woman, more fat, wider hips, right? And able to carry the child once it's fertilized. Menstrual cycle, I kind of simplified the day 1 through 28. The hormones are estrogen and progesterone that are cycling. This is totally simplified, but every 28 days or so, the cycle repeats. Menstruation, menarche, so that's your first one. And then menopause, you have perimenopausal. What's peri? Around, right? So around your menopause, you're going to have stuff before and after. If you get a hysterectomy, you win twice. You get menopause twice. You get physical menopause, because we physically removed your organs, and then you'll get chronological menopause, which you'd get anyways around age 45, 50. So you get it twice. You'll have to educate your patient. All right, anterior pituitary, follicle stimulating hormone. Of course, it's going to go to the ovarian follicle, thickens the uterine lining. Then it releases luteinizing hormone. And then remember, if there is fertilization, it goes to the corpus luteum. So the L kind of helps you memorize where it goes. And that helps support progesterone if there's pregnancy. So, if you're pregnant, can you get pregnant again? Wait, if you're pregnant, will you release an egg again? No, because of this guy. This guy is now maintained, and you no longer cycle estrogen and progesterone. So, can you get pregnant twice? No, right? So how does birth control pills work? No, it tricks your body into thinking, I'm already pregnant. I can't be pregnant again. So if I regulate or manipulate your cycle, I can manipulate if you ovulate or not ovulate. So if I trick your body into thinking it's already pregnant, it's not going to ovulate. You won't be able to get pregnant because your body thinks it's already pregnant. So no fertilization, the corpus luteum, of course, breaks away, degrades, and then you don't get progesterone. Now your estrogen goes back up, you start the cycle again. So only if there is fertilization, corpus luteum is retained, and you get progesterone. And then menses take place, and we start the cycle all over again. 28 days, just like the moon cycle. All right, endo, which layer is this? The inner layer. So growing very fast because every month it needs to grow and then it gets sloughed off. It has to regenerate, get sloughed off if there is no fertilization. So just imagine that fast growing tissue outside the uterus. It's going to act just like cancer. And they give the same chemomeds to treat it. Fibrocystic breasts, now they call it changes. So ladies, are you touching yourself? No, supposed to touch yourself once a month. We are not looking for fibrocystic breast changes. So these are normal. They're just cystic sacs. Sometimes they're filled with fluids. They can cause pain. Just a needle and they'll drain the fluid. But it's not cancerous. They're soft, right? But when you look for breast cancer, remember you're looking for firm, like a P, something hard. Fibroids occur on the uterine wall. And you can also get ovarian fibroids. Those will just be little tumors on the ovaries itself. Ovarian cancer, just like testicular cancer, affecting the gonads. So what did Angelina Jolie remove? Uterus? Uterus and ovaries? Breasts. Which one? What else? She removed her lady parts, but I'm not sure which one. I think she had a hysterectomy, but did she remove the ovaries as well? Sometimes they leave the ovaries in, sometimes they take them out. So I'm not definitely sure on her case. All I know is double mastectomy and some kind of hysterectomy. Partial or complete, I'm not sure. And that is all just to prevent cancer, because in her family, supposedly her family members have a history of breast cancer and she has the gene for it. So she just preemptively, as long as you don't turn on your cancer genes, you're fine. So don't expose yourself to chemicals, stay out of the sun, you should be okay. So women, breast cancer. Mammograms, they're saying, aren't as effective as self-breast examination. So when you do your physical, or every 6 months, your doctor should be doing manual examination. And then for mammograms, now they're saying every 2 years is fine. They used to require it every year. I mentioned the P&P, pelvic exam, and pap smear. So they're actually going to scrape off some cells in your lab procedure, or your lab for assisting with procedures. We'll talk about more how to assist in a P&P. Inflammation of the neck of the uterus, right? So cervix is generic for neck. Dis, what is this? abnormal, painful, difficult menstruation. Premenstrual syndrome, so before. So usually this occurs because you have a dip of estrogen. Estrogen is required for well-being, good, healthy mental state. So they found that women in their 50s, age 50 and beyond, they usually have low estrogen. And they used to just give women estrogen all the time. Too much gives you cancer. Not enough, you get all these weird symptoms. So they have to find a balance. Inflammation of the vagina. And then we have the endometrial cancer. So that's endometriosis, or cancer within the endometrial layer. So those genes, as long as you don't turn them on, you should be okay. Pregnancy. So we won't talk too much about the developing fetus. Just a little bit on like the veins and all. So fertilization. So everyone in here, you guys are winners, right? You won the most important race of all. You were the first sperm to stick its head inside the egg, and then it trapped everyone out. So remember, the egg has a coating that needs to be dissolved. So all the sperm that's there, they'll need to dissolve that layer before the first one can enter its head. So instantly, as the first one's head enters, the cell just shuts out everything else. That way you don't get fertilized twice. So you get the zygote, the union. Now we have 46 chromosomes, and then that cell will start to divide. So how do you get twins? So you can have 2 eggs plus 2 sperm. So they call that fraternal twins, right? So they might be not identical. And then when you get identical twins, that's when you get this zygote and it splits into 2. So since these are just stem cells, right, if you split them, you'll get 2 completely identical twins. And then if this guy splits again, you can get triplets. So that's how you get identical triplets. And then if it runs in the family, guess what? Normally you might get quadruplets. Right? So the cell divides. All it's doing is copy, 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 clone of itself. And then the cells will start to differentiate. They'll start to be different. So here in the morula, you'll have all the cells making kind of like a ball. And now you have different layers. You have an outer layer, ectoderm for the outer layer. You have an inner layer, endoderm, and then you have a middle layer, mesoderm. And depending on what layer of cells it is, will determine what it's going to turn into. So you're no longer a stem cell, right? So it used to be, now the cell can become anything. Now if you're on the outside, you can only become skin. If you're in the middle, you can only become bone, right? Blastocysts. So now that is what will embed itself. And then once you start seeing the features like gills, right? During our development, we'll actually have gills, just like fish at the beginning. We actually have a yolk sac, just like an egg. We'll also even have a tail. So if you look at a pig embryo, fish embryo, sometimes reptile embryo, it's all going to kind of look fishy, the same with the tail. And I'm not a bird, why do I have a yolk sac? So everything remains. The union between the mother and the baby is the placenta. So the baby, from its abdomen area, it'll send up blood vessels, and from the placenta in the mother, right? It'll send up blood vessels, and then that will form the placenta. So you got 3 cords. Right? You got a backup blood supply going to the baby. So you have an artery, a vein, and then another artery supply, just as a backup. So here are the layers: the outer layer, middle layer, and then the inner layer. So depending on what cell layer you came from will determine what type of tissue you are. So if I want to grow back joints, have you guys heard of this? Regenikine and stem cell treatment. So they take these stem cells from your blood, they spin it down, and they separate the stem cells. So most of that is mesodermic stem cells. So that's what makes your bones, connective tissue. So a lot of athletes who have joint problems, they're injecting stem cells, and their joints are recovering a lot faster than surgery, or they supplement that with surgery. So we kind of stopped stem cell research because of the ethical reason. So since we're using adult stem cells and not from embryos that didn't have a chance to live, then this is more ethical because it's my own cells, right? You're just spinning my blood, concentrating so it can go where it needs to go. Second way is to get it from bone marrow, so that's more invasive. But if you don't have to get it from bone marrow, just spin my blood and then just inject it. I want the fountain of youth in me. Repair yourself. All right, the fluid. The amniotic sac will also contain the amniotic fluid, so the water that breaks is the amniotic fluid. So inside, the fetus is sucking in air. No, sucking in fluid. So the lungs are the last thing to actually develop. So remember, surfactant we talked about in respiratory system. If you're a preemie, most likely you'll have respiratory issues. Mention the yolk sac. So that's just like the yolk sac of an egg. It's for energy. So it's a lot of fat and protein. Quick energy supply, but for us it goes away. Fetal. Now you have rapid growth. What is the muscle that's most active, most developed? What do you think in the fetus? What do you think is working the most? Yeah, the leg muscle. So the thigh muscle is probably the most developed when they come out. So most injections that you give IM to babies will be in that vastus lateralis, that big thigh muscle. Gestational diabetes is dangerous in the 3rd trimester, where the baby will put on a lot of weight. So if there's a lot of sugar, the baby can't, in the blood, the baby can absorb that sugar and then grow way too big. Last 3 months, brain, and of course the first 5 years, rapid brain development. And then what happens during puberty, 12 to 13, is the brain remaps. So the first 5 years are important, but also those puberty years, super important as the brain reconnects. That's when a child kind of gains their personality. GI, respiratory. So here the nutrients from the placenta goes directly to the liver. Right, so instead of going through the circulation first of the GI tract, it just goes straight to the liver. The placenta is amazing. There's certain things it can filter out. For example, HIV. You guys heard of HIV? So if a mother has HIV, inside the womb, the child is protected. The child will not have HIV. So if we know the mother is HIV positive, we're going to cut the belly open, take the baby out, and start the kids on meds right away. So as long as we know, then that baby will never contract HIV, as long as we prep for it. So that's a good thing. The foraminal valley is the hole in the heart. So this is between the right atrium and the left atrium. So normally, from the right side, it should go to the lungs to pick up air. But since the child is inhaling fluid, there's no reason to go to the lungs. So the blood just hops over to the left side and they get pumped to the rest of the body. During birth or close to birth, this hole, foraminal valley, should close. If it doesn't, you'll get that leaky heart, the murmur sounds. Ductus arteriosus. The one that's important is ductus venosus. This one bypasses the liver from the GI tract. And then it becomes the portal system afterwards. Pregnancy tests. Ladies, if you want to take one, let us know. We have them in the lab ready to go. Sometimes we have a surprise positive when we have that class. So what are we detecting? We're detecting chorionic gonadotropin hormone. So this is part of the placenta. All right, so this is not effective immediately upon fertilization, right? So remember that luteinizing hormone after fertilization will support the corpus luteum, and then you'll start getting development of that placenta, and that's what we're detecting here. So if there is fertilization, the corpus luteum is maintained, and luteinizing hormone will further develop it, and it'll produce estrogen and progesterone throughout the pregnancy. That way, you can't get pregnant again. Can you ovulate again? If FSH is inhibited? Yeah, FSH causes follicle to form, but if you inhibit it, no egg production. Contraction. So you got relaxin, other hormones that are involved in the contraction. So relaxin inhibits uterine contraction. Oxytocin, the same one for bonding, the same one for lactation. The one during sexual climax, it's the same hormone for contraction, secretion of milk, and bonding. Production of milk. So before birth, you do not produce full milk. The female does not produce full milk. She'll produce cholesterol, which is high in antibodies. So very important breastfeeding, because it'll allow for the child to get immune protection from the mother. Water retention. What happens to feet and ankles? Swollen. Now you know why. Right? Increase aldosterone, increase sodium. Whenever you have salt, you're gonna have water. So margaritas this weekend, ladies. Salt or no salt? No salt, because it's gonna make you bloated. So margaritas without salt. Now you know. Bone. Calcium comes from the bone, and then it goes to the blood. That way it can go through the placenta to the child. By definition, the fetus is a parasite. Yeah, by definition, fetus parasite. All right, birthing process. Progesterone falls, right? So remember, this is the male hormones making sure that you're not pregnant again, but now it's falling. It doesn't maintain pregnancy, which means it's time to be born. Prostaglandin, so that same inflammation, injury response hormone. So this is a local hormone, so it only works in the uterus area. Right? It doesn't go throughout the whole body, causing the whole body to contract. Right? Just works in that area. Oxytocin, the brand name is Pitocin. So that's the one, they'll hang a big old bag and then you wait. Usually about an hour it'll start kicking in. And then by the end of it, most women will be dilated enough to deliver. If not, they'll hang you another bag until their contractions are how far apart? So at 6 per hour, you go to the hospital. And then how far apart do you start pushing? It's like a couple minutes or something? Yeah, 1 to 2 minutes. You guys remember? No, because oxytocin also erases the memory of pain. Alright? So it tricks you in falling in love, staying with the man, and then once the baby's out, it erases the memory of the pain, so you want to have another child. Where can I get some of this stuff? You can get little tiny vials at the pharmacy, but it doesn't work the same. Dilation. So, depending on labor, it can last short or extended, prolonged, depending on position of the child, hormone levels. Expulsion. So that's when babies come out. Should be about 30 minutes or so. And then we usually get the afterbirth, right? The placenta. Some traditions, what do they do with this placenta?
Eat it.
Oh, yummy. Just like the animal kingdom. The first thing the animals do is they eat the placenta. So do they cook it? I don't know.
They put them in capsules now.
They put them in capsule?
Some people eat that now. They got groups that do that.
Alright, so what's in the cord blood? What's in the cord blood? Stem cells. So these are almost like the first stem cells, but they're what they call pluripotent. They can't become everything, but they can at least become a lot of stuff. So if you extract it, freeze it, and your child or family member has a genetic disease later on, what did I say about stem cells? Just stick them in where you need them, and your body will know what to do with them. And it can, if you have blood conditions, replace all the blood in your body to give you healthy blood cells. For the baby, first month is the neonatal period. First 6 weeks, what do they call it? Postnatal? So that's kind of confusing. But neonatal is always the first 4 weeks. The first year is infancy. So the first year is infancy. Prolactin is the hormone. Helps produce milk. Oxytocin, another function is positive feedback. When the mother hears a child cry, what happens? Releases a little milk, right? Because that's a positive feedback response. As long as the baby's crying and there's milk, there's going to be a release of it. Contraception. Ooh, the rhythm method. So what is the rhythm method? What's the rhythm method?
You only have sex when you are
Not ovulating, right? So you ovulate, the egg is viable for about 48 hours. So if you don't have sex a couple days before that, don't have sex a couple, 2-3 days before that, then you miss the window, you're never gonna fertilize, right? Coitus interruptus, that's the pull-out method. The rhythm method we just described. So for religions that don't allow contraceptives, then it's the rhythm method. Mechanical barriers. So these are things like a condom or a diaphragm. Are you guys familiar with the diaphragm? So, or a cervical cap. Sometimes it's called a cervical cap.
you can still have those.
Probably not. You need to get fitted for it. Not one size fit all. But it's just a cup that fits over the cervix, and you're supposed to say, "Excuse me, 1 minute." Insert the diaphragm, and it's more effective if you use it with chemicals as well, like a spermicide lubricant. So that's the chemical barrier. So it can come in foam, film, lubricant, and it has usually a spermicide. Oral contraceptives. So what do? We manipulate estrogen and progesterone. So there's monophasic, there's biphasic, there's triphasic, and that just tells you how much they manipulate the menstrual cycle. Some prevent your body from ovulating. Some prevent the uterus from being sticky enough to attach, even if there is ovulation. So they all work a little bit differently. Make sure you know which type you're using. Women on oral contraceptives should not do which of the following, because it makes their blood sticky and more likely to clot. So if you're on oral contraceptives, make sure you don't smoke. They'll tell you stroke risk is high. Injectable and or deposits. You guys heard of a depot? So depot just means a deposit. So they inject a deposit of the hormone within your body, and it slowly releases over time. The inserts is similar. Instead of depositing a little bit of drug in the body, we put an insert. So sometimes it's those 2 or 3 inserts under the skin. Depending on the type, some you'll menstruate normally, usually with oral contraceptives. Some of the injectables, you menstruate every 3 months, and then some other one, you don't menstruate at all. The bad side, when you come off of them, because it's affecting your hormones, and your body will need to readjust. So if you've been on contraceptives for a while, and now you want to have a child, then you gotta get off of them, make sure your cycle's back to normal, and then go from there. But a lot of young girls will go on oral contraceptives early just to regulate their cycle. So if they have dysmenorrhea or something wrong, it's just a patches, transdermal contraceptives. So they're weekly patches. So you do them for the first 3 weeks, and then that 4th week, do you get hormones? No hormones, right? So usually that 4th week, there's no hormones. If you're doing oral contraceptives, even in that 4th week, there's no drugs. They're gonna give you placebos. So they're gonna give you sugar pills or iron pills to replace the iron that's lost during menstruation. So still take them if they're the oral contraceptives. Intrauterine device. So these implants can be kept in place, some for 5 up to 10 years. Have been some issues of them moving or causing issues. So just do your research before you pick the contraceptive type. So this leads us to discussion 2, right? So we have that 36-year-old mother of 5, and now you kind of have an idea of the different types. Just recommend to her which one to use. Tubal ligation. What are we cutting here? Vasectomy. What are we cutting here? Is either 100% effective? No. So you're going to have some super sperm or some super eggs that come through. Inability to conceive. So about 6 months to a year, I think, is the time frame. Could be a primary cause. So this means the reproductive organs have a problem. Or it could be a secondary cause where a different disease is causing problems with fertility. So for males, easy enough. They'll just do like a sperm count or a sperm activity. So even if there's high count, the quality of sperm also is evaluated. Retrograde. What's retro? Behind, backward. So this is like delayed ejaculation. So climax, 6 months later, then ejaculation. Okay, you guys got the joke. Okay, six minutes later. Yeah. There's a dirty joke, but you guys can look that one up. Female related. So the uterus can have a lot of problems. So there could be ovulation or not. Even if there is ovulation and fertilization, there may not be any implantation. Some women have oddly shaped uterus. That's hard for sperm to actually travel to the egg. So a lot of things can go on. Worst comes to worst, a little IVF, right? In vitro fertilization. So body temperature is to monitor for ovulation. So if you're a groupie, an MBA groupie, you'll have your ovulation monitor with you every time. We used to have a lot of them in San Diego for the Chargers. Blood hormone. This is salpingogram. What are we looking at here? Uterus and the tube, right? The uterine tube. So treatment, drugs to help you ovulate. If you're doing IVF, they need to have you ovulate more often so they can harvest the eggs. So you can have the eggs frozen, but a better option is to freeze the embryos. The embryos seem to last longer than if you just freeze the egg by themselves. All right, home stretch before we go to break and work on the in-class assignment. HIV, we mentioned in the blood chapter that once your T cells fall below 200, you're pretty much no longer protected, and that's full-blown AIDS. Chlamydia, I think that's the most common reported. Stay away from Oceanside. I think there's like a 2014 report that the highest case in the San Diego area was in the Oceanside area. So what's in Oceanside? Camp penalty. So I'm not sure if they correlated with that, but that was an old report. What causes warts? Virus. Warts are tumors, and what can tumors lead to? Cancer. Gonorrhea, probably the second most reported. The dangerous thing now is we have drug-resistant gonorrhea. So you can get gonorrhea that's hard to treat. Herpes, we got simplex 1 and simplex 2. Simplex 1, oral. Simplex 2, genital. These viruses don't care. If it's skin, it'll infect it. Lice, so just in the pubic region. So you can have body lice, head lice, here, pubic lice. Syphilis, so it can cause dementia. So a lot of undiagnosed dementia is caused from syphilis. Trichomonas, what's a protozoan? Yeah, so malaria is a type of protozoan. Here we have Trichomonas. So it's not a bacteria, it's not a fungus, it's a protist. So this can infect the body, in this case, the vagina. Pseudomonas, same thing. They're a type of protozoan. Alright, so that ends male and female reproductive system. Let me give you guys the access code for today's assignment.